So as you guys know, we have labor support education going on the unit. Here on our board for supporting vaginal birth, we are featuring the Lavon circuit for asynclitic babies. This Lavon circuit comes from bundle birthing, which is a form of labor support, which Morgan is going to talk to you more about.
All right, so Bundle Birth Nurses was started by a labor and delivery nurse in Southern California as a way to educate labor nurses on how to better care for patients and how to focus on physiologic birth. And they have a really great class on labor support and physiologic birth, if anyone's looking for something to
There's
educate.
like a couple nurses that took bundle birth. So you took it?
Simran, Taylor, I think some of the newer gals, Sarah may have taken it. There's a few of us that have taken it. I have some of the resources in my box too if anyone's interested. But the Lavon circuit is it's a combination of positions and movements during labor to help get a baby from an asynclitic position to more of a unasynclitic position.
All right, great. So we're just going to do a quick video to show you each movement and explain. Okay, so the first part of the Lavon circuit is sideline release. I know a lot of us know what this is. But what you're basically doing is softening the pelvic floor. You're going to do this on both sides for 3 contractions. And this is just to reduce constriction and make more space. So here Morgan is in sideline release. What I found, so you want to make sure you're not just leaving your patient in this position, but what I found that really works is doing like a little hip rock with it in between contractions or during, if sometimes that just the pressure on the low back helps. But sometimes I have noticed that doing this, people just really relax, epiduralized or not. And I did this with Imperiale and with Pomerantz, and just doing this hip rock really helped. Both of them were just went like melting into the bed. So this is still part of the sideline release. We just flip sides, and then just reminder points is that this back leg is like a pencil leg. You're gonna flex the foot there, and you really want belly like almost at the edge of the bed there, and letting this leg hang, making sure that you're still supporting their hip. Okay, so step 2 is puppy pose. So the purpose of this is to disengage and reset baby. You want to do this for, if you can, about 30 minutes or until your patient can't tolerate hands and knees in this position. One thing too that you can do is put the bed in a slight Trendelenburg. And we're going to add the booty shake. Also, some people have heard it called shake the apple tree. And we're going to do that for 10 minutes or so in between contractions. So I'm going to show you, just as a reminder, how to get the bed back in Trendelenburg. There's a lever down here.
Oh, I'm in Trendelenburg.
Okay. So, as you can see, she's in that Trendelenburg. Okay, while we're in this puppy pose position, you want to make sure that your bed is locked, that you're not leaving your patient alone. You can also have up your side rails. I just have it down so that you can see. But what I did is just took a sheet here. I'm going around the hips. So what she's doing right now, she's just really relaxing her pelvis, and we're just doing a little shake from side to side. So the goal here is to kind of maybe get the baby to disengage a little bit, bring the baby up so that we can kind of reset and reposition. And so just this little booty shake.
So number 3 is flying cowgirl, my favorite position. The idea of this position is to help get baby more engaged. Ideally, you want to use this at like -3 or -2 station, but you can use it at any station as well. You want to do 30 minutes on each side with a large peanut ball, so large that the patient's ankles don't touch. And you want to initially turn her to the side of the baby's back, but you want to do both sides for 30 minutes if the patient can tolerate it. So we will demonstrate here. So what I like to do is I like to kind of get the patient in position first, and I explain, I want you to push your pelvis out toward me as much as possible and arch your back into like a C. Sometimes it helps to say, if you move your head back on the pillow, a little bit, yep. And then we're gonna bend your legs here and push your knees back, yep. And then we're gonna put the peanut down low between the ankles here. Right there, and sometimes it can be a little bit unstable, so you can like pack some blankets behind it. But essentially you can see here that she has pushed out her pelvis as much as possible. She's extending this part of her body, trying to make room to let the baby settle lower in the pelvis. And 30 minutes each side, like we mentioned. And so yeah, give it a try. Ready? Number 4 is called Open Sims with peanut ball or pillow, or even stirrup. So this you're gonna do for about 30 minutes with your patient. It's gonna help baby descend and encourage the baby to turn to OA. You're gonna place the patient on this opposite side of baby's back. So if you're unsure of what direction the baby is facing, go to the right side first and then the left. And position is always going to be told by a cervical exam, so try to ask your physician to be as detailed as possible, or try to feel for fontanelles yourself. And then we're going to repeat it on the opposite side. So let's see with this one. So Morgan here is completely on her side. What helps is straightening the lower leg and then bringing this leg up, just like this. That's perfect. And you can achieve this with a stirrup, with pillows, whatever's comfortable for your patient.
You can also pull the stirrup out to kind of lock the ball in place if you needed to.
Yes.
Just like that. All right. Go.
So another pointer for the Sims position, if you can, what's really great is if you can get the patient to turn all the way onto their belly pretty much, and their arm is gonna stretch back here to like just really encourage that rotation. And this is just kind of showing it with, if you don't have a peanut ball, that you can do with the stirrup as well.
So the Levant circuit has worked for me in the past. It was a situation where I had a patient where she hadn't been progressing, the baby clearly felt asynclitic, and they were at the point where they were gonna, the next check, if she hadn't changed, they were gonna go back for a C-section. And so in that circumstance, I asked for some extra time, and at that point they wanted to check in like an hour, but this loop or the circuit can take about 2 hours if you do it right. And so that's something to communicate that with the doctors about, and just kind of advocate for that extra time to see if you can get your patient that vaginal birth, if we can get that baby to rotate or move a little bit, maybe some cervical change can happen.
Yeah, and we are working on getting some handouts to keep at the bedside, just to help patients buy into what we're trying to do here. If they're, or to let them know, sometimes if they can see a visual and they know what we're trying to achieve, we might get better buy-in.